Welcome to this lecture, that is Barbiturates. We will revise only in 5 minutes this lecture and introducing that barbiturates are a class of sedative hypnotic drugs that have been used for various medical purposes and as recreational substances, and they were first synthesized in the late 19th century and gained popularity as sleep aids and anxiety relieving. Actually, barbiturates were widely prescribed for their sedative and hypnotic effects until the emergence of safer alternatives like benzodiazepines. And now we will talk that what is the mechanism of action. Actually, barbiturates enhance the inhibitory neurotransmitter, that is GABA, also known gamma aminobutyric acid, in the brain, and it leads to the increased inhibition of neural activity. So, by binding to GABA receptors, they amplify the calming effect of GABA that results in sedation and reduced anxiety levels. So, the exact mechanism of barbiturates is complex and may vary depending on the specific subtype and dosage. So, the medical uses, actually, barbiturates have been utilized for anesthesia induction and maintenance during surgeries. And today, barbiturates are occasionally used for specific medical conditions such as reducing intracranial pressure in traumatic brain injury. It's important. And the classification and dosage forms, actually these are classified based on their duration of action, which categorize like short acting. The most common example for short acting is pentobarbital, and intermediate acting example is amobarbital, and long acting, for example, phenobarbital. And they can be administered orally, intravenously, or rectally depending on the specific drug and medical situation. The side effects or the common side effects of barbiturates include drowsiness, dizziness, and impaired coordination. Overdose can lead to severe respiratory depression, potentially resulting in life-threatening consequences. The regular use of barbiturates can lead to tolerance, dependence, and withdrawal symptoms upon discontinuation. So, the barbiturates misuse and addiction. Due to their sedative effects, barbiturates have been misused recreationally for relaxation or euphoria. So the risk of addiction is high, especially when it's used in high doses or for extended periods. Combining barbiturates with other substances like alcohol can be extremely dangerous and may result in fatal respiratory depression. When we compare with other sedative hypnotics, barbiturates differ from benzodiazepine and other class of sedative drugs in their mechanism of action and safety profile. Actually, the benzodiazepines have largely replaced barbiturates in medical practice. Why? Because of their low risk of overdose and respiratory depression. And that was the short overview. And concluding the lecture, we have to know that barbiturates have played a significant role in medical history, but their use has diminished due to safety concerns and the availability of safer alternatives. Understanding their mechanism of action and potential risk is crucial to ensure responsible use in medical settings and raise awareness of the danger of misuse. So thank you for watching, and if you want to solve the quiz, let's see you in the description of the lecture. You will find very useful MCQs related to the barbiturates.